within reason. So if we go find where we are, and one of the most important things to do when you're got a needle is to identify where you are. We talk about a lot on this on the clinical anatomy and palpation stuff that we've done together. It's very important to find out where you are, because it's going to help you with your diagnosis, it's going to help you with your objective assessment, it's also going to help with your differentiation when you put needles in and find the structures. The other thing about needling as well is when you put a needle in, if I'm saying to you we're going to needle this structure or that structure and you put a needle in, you're essentially putting a flag in the ground and telling me that's where you are. So when you do that, you know, you're focusing really key on that location. When you're doing exercise, it doesn't really matter so much, you're a little bit more global. Oh, we'll do this exercise, whatever, you know, it can be a little bit more global. When you're doing manual therapy, you can just have your whole hand on there and you can be like, oh, I'm doing this. When you're needling, it's 1/4 millimetre. That's how big your target is. And you're putting it in and you're saying, that's what I'm in. Well, that becomes very specific after a while. But if you can be specific to the needle, then you can be specific for everything else, because it's much more, how can I put it, it's much more challenging to be specific with a needle. So let's just do a little bit on palpation here. Let's find the iliac crest. If I find the iliac crest, I'll move across to the centre. I'm just going to put my ring finger in the middle there. I think that's probably about L4-5, but it's a guess. Okay, so what I'm going to do is I'll palpate the intervertebral space below, and I'll palpate the one above, interspinal space above there. So I've got 3 spaces there. There's one there, and one there. And I think one of those must be at least L4-5, but I'm not sure exactly which one it is. So what I'm going to do is I'm just going to have a look at the sacrum. So if I can palpate it from the back, I will, but if I can't, I'm going to go to the anterior aspect. I'm going to find the ASIS, which is there. I'm just going to slide my hand back, and there's the PSIS, because they'll be in line with each other. It's part of the geometry of the pelvis, which I'll show you in a minute. So there's the PSIS. If you drop inferior medial to the PSIS, you've got the sacral foramen of S2. So then, when I look at these, and I come across here and I think, okay, well, where are we? So if we look at these 3 points, there it is. Okay, I thought that was a little bit close. So if we look at this now, if I take this one, first of all, and I select one of the 3, and I'll just take the closest one. If this is L4-5 and this is S2, I need to get L5 and S1 between my fingers, which, looking at the height here, is probably a little bit too close. So don't go to the next one, go to the furthest one away that you just checked and look at that one. If this one's 4-5, then I've got to get L5 and S1 in that space, but only those 2 vertebrae, nothing else. It's probably not going to make a lot of sense. So it's most probably going to be that one is L4-5. There's the space. That's going to be there. Because that would allow me to get an L5 and S1 and get to an S2 in that position. Okay, that makes sense to me. So basically what I'm doing is iliac crest, come to the centre, find one, go one above and one below, ASIS, PSIS, drop into S2, and then evaluate the relationship between the closest one, the furthest one, and then the one that's left. So if this one's too close and this one's too far away, the one that's left must be the level that it is. So that's palpation by deduction. So you remove what it can't be and whatever's left, no matter how improbable. So you remove the impossible, whatever's left, no matter how improbable. Must be the truth. Bit of Sherlock Holmes for you. There you go. But that's what it is. It's just deductive. Because one of the things you need to understand about palpation and anatomy, particularly anatomy, is no 2 things can occupy the same space in time. So if one thing is there, something else can't be there. Something else must be there next to it, and then something next to that, and something next to that. And that's going to be important later for the pelvis to understand the sequence of things. Okay, so now we've identified that, we can needle. So if we're going to needle now, and we're going to needle the lumbar spine, we can start by needling the bladder channel. Okay, if we want to needle the bladder channel, we need to understand that we want the height of the erectors. So if we look at needling the inner bladder channel, it should be about 2 fingers out, shouldn't it? And we're going to longissimus. Simple enough. Okay, well, where that will be, so I can just lift your strap slightly. If we go to the thoracolumbar region, it will be halfway across the height of the erectors. So that will be the inner bladder channel, which will also be the same, if I can borrow this arm and put it down by your side, it will also be the same as half the distance from the superior medial angle to here. So that distance there, which will be 3 son, will be the same as that distance from there to there, which will be 3 son. That will also be the same as Keris's hand there and Keris's hand there. Half this distance here from there, spinous process, to the superior medial angle, if I halve that, that'll be 1.5 son, which will be about 2 fingers. It will also be, down here, 1/2 sum will be 2 fingers. What it will also be is half the erectors. It will also be the highest point on the erectors. So we've got the geometry of anatomy here working for us. So when we measure that, so take that distance, halve it, put your fingers on, calibrate it, come down to the thoracolumbar region and have a look at what that equates to there. It should equate to halfway across the erectors. If it does, you've calibrated it, you've checked it, you're good to go now. All you subsequently need to do then for needling anything down here is know which spinous process you've got. If you've just worked this out, you know where 4 and 5 is. If you're needling the lumbar spine, well, it's not difficult to count the others now. You just count up or count down from there. So let's just have a look at needling bladder channel, and then we'll look at needling HTJJs from there as well. You okay with that?